Welcome to the Motivational Midwife. My name's Lynn Jones, and today I want to really spark some discussion and get you thinking about why it's important for you as midwives and even student midwives to undertake ILS. So my hope is that this short presentation will make you really think about how important it is for you and as a student midwife to undertake ILS in order to better care for the people that we are looking after. So what is ILS? So ILS stands for immediate life support, and it's more than your basic life support. So basic life support, we are required, whichever trust you work in, you are required annually to undertake basic life support updating. Immediate life support kind of goes that next step further. So you learn how to recognise deterioration quickly and initiate appropriate treatment until the rest of your MDT team arrives, but continue to support the team. And I can already hear people saying, yes, but our birthing people are fit and healthy. And yes, they are. By and large, most of our population that are having babies are fit and healthy. But things change. Cesarean sections, major abdominal surgery with all inherent risks of surgery. Antepartum, postpartum hemorrhages, people can deteriorate very rapidly. Eclampsia, sepsis, this is not an exhaustive list. There are a lot of conditions now. A lot of birthing people come with pre-existing medical conditions and comorbidities that actually the pregnancy can exacerbate. So it is even more vital that we are picking up on those early signs of deterioration. So why should we bother? Why is it important? Well, looking at this year's Embrace report, the overall rate of maternal death was 20% higher than in 2011, 2013, which was when the government produced a mandate to say they wanted to halve maternal mortality. So here we are, it's not halved, we're actually 20% higher than it was when that mandate came into place. There's no real statistical significant difference in the overall maternal death rates between the 21-23 and the 22-24 rates. But overall, the maternal death rate remained higher than the last complete triennium, which was 2019 to 21. Even when you exclude COVID deaths, the rates of overall and indirect causes are statistically significant. They have increased in that last triennial, that 22-24. And the leading causes of maternal death remain sort of thrombosis and thromboembolisms, hotly followed by cardiac disease. And there's obviously suicides and mental health and things come behind that. But these are the two that are the ones that are the leading causes. So I mean, the findings of the Embrace report really, for me, just hit home hard that we're still not doing as well as we should be. We're still not picking things up as well as we should be. And for me, this really just cements why I feel all midwives should do that ILS course and have that greater underpinning knowledge and skills of how to systematically assess somebody and initiate appropriate treatment. Anyone that's ever looked after anyone that's had a pulmonary embolus, so a clot that's gone into the lung, will realise that they can deteriorate exceptionally quickly. And if we don't manage it well, it will lead very quickly to cardiac arrest, as can any blood clot. But I think sometimes we get lulled into a little bit of a false sense of security, and we forget that actually DVTs and embolus are life-threatening conditions, potentially. So I think, we need to really take a step back and remember that this is the leading cause of maternal deaths. And this is deaths in the UK. This isn't deaths sort of worldwide. This is here where we're living and working. The numbers worldwide will be significantly higher, but to be 20% higher than a decade ago is really quite disturbing, I think. Cardiac disease being the next leading cause, well, very often people don't realise that they have got some underlying cardiac disease. And pregnancy, as we know, increases the circulating volume by 50%. So you've got increased load on that circulatory system. So it may be that's the first time that any of these issues actually come to light. So we need to be very, very vigilant. As I have banged on about, I think all midwives should undertake it, but as a minimum, I think labour ward leads and community midwives should do this. Community midwives, you're very much working on your, not in isolation, but you are one or two of you out at a home birth. If that situation deteriorates quickly, you want to be able to manage that well until your help arrives. And that's not saying you don't do that now. However, having these added tools, you may be able to really recognise that something's not quite right earlier than you perhaps historically would have. And labour ward leads, obviously, you are on the labour ward. It's often where situations can change very rapidly, and having that greater knowledge really will help support not only the people in your care, but your team that you are leading for that shift. So what does it involve? So you have two options. There is a one-day ILS face-to-face course, and in the morning that is lectures and discussions, and in the afternoon it's a very practical assessment and session. So it's a continuous assessment for the whole session. So it's a series of airway management and also scenario based, which get progressively not more difficult, but they do change. The scenarios do change. You're very much encouraged to work as a team, and you are you do. I mean, the courses that I've helped teach on, it's very apparent how quickly that people have never even met each other before that session can work very quickly together as a team using the techniques that you learn within the course. Or you have the EILS. So the morning session is replaced by online modules and videos that you work your way through at your own pace, as long as they're all done before you attend your practical session. There is a pre-course MCQ that has to be done prior to actually attending the practical session, or if you're going for a face-to-face, prior to actually attending that face-to-face day. And so why is it different from basic life support? So basic life support, you learn to recognise signs of cardiac arrest, and making the call is cardiac arrest, putting that call out, and starting your CPR. With ILS, you learn as a very systematic A-to-E approach. So why is it important to be systematic? So you don't miss anything out. It's very easy to potentially think the problem is being caused by A, when actually it's not. It may be something else. So being systematic and following that A to E approach will mean that you don't miss anything out. You learn about reversible causes. So things that potentially are input, a lot of this is trying to stop that cardiac arrest actually happening in the first place, because we're picking things up early. So you learn about reversible causes and things that we can actually make a difference with. You learn about how to escalate appropriately, and certainly in a lot of your prompt training and teachings, a lot of it, and certainly from the Resus Council as well, a lot of it is around appropriate escalation. In the video I did on meows, I talk a little bit about appropriate escalation. So who are you escalating to? You know, do you really need the SHO, or do you need actually a senior registrar or a consultant even? So appropriate escalation. And you learn a bit about the resuscitation drugs and when you would use them. And so for more information, if you log on to the Resus Council UK website, and the link is there, then you'll be able to see where courses are available in your area. In terms of cost, as I say, they're not hugely expensive. I think I did mine off my own back, and it cost me £30, so it wasn't a hugely expensive course. They are annual courses, so you do need to do them every year. Your certificate lasts for a year. It's quite good for CPD as well. It's because it is it counts for your participatory updates, you know, or practice development. So it can go to that as well. But you know, it's always worth talking to your line manager first and seeing if you can get that provided within your own trust, because very often a lot of trusts will provide their own ILS courses. They're Resus courses, RC UK Resus accredited courses, but they're run within your own trust. So it's worth really, or speak to your Resus department. They'll be able to tell you whether or not they run courses there. As I say, I did mine within the trust I work for, but with, off my own back. And it was very good. I enjoyed it. There's also the advanced life support, which again I would say is useful for anyone that's in a senior position. So there's labour ward leads, because that just digs into everything a little bit more depth. You learn about cardiac rhythms and various other things, but it's also a very good course. And there you have it. I hope that's made you think about really having a look and trying to book yourself onto an immediate life support course. Log into the RC UK website and see if there's any going near you. Really do seriously consider undertaking it, because, as I say, the population we care for now is much more complex than it used to be. And so it's even more crucial that we really detect deterioration very promptly and treat it, in order that the people in our care have the best possible birth experience they can have. If you haven't subscribed to the channel already, please do so. If there's anything you'd like me to cover, then please drop me a note in the comments, and I'll do my best to do that. I look forward to seeing you next time.